Hi, this is Dr. Paul Song. I'm the president of the California chapter of Physicians for National Health Program. And today I'd like to talk to you about why a public option is not sufficient and why we need Medicare for all. Back in 2010, the Affordable Care Act was signed into law. And while it's achieved some positive things, such as eliminating the discrimination against pre-existing conditions, expanding Medicaid, and providing more preventative benefits, there is still a lot of work that was not done and a lot of problems that still exist. During the run-up to the Affordable Care Act, there were 3,300 registered healthcare lobbyists for the 535 members of Congress. They were spending $1.2 million a day, and in total, more was spent lobbying Congress than was spent on the Bush-Kerry election. And that's why The Lancet took a highly unusual step of dedicating a special issue to the Affordable Care Act process, saying that the healthcare reform process exposes how corporate influence renders the US government incapable of making policy on the basis of evidence and the public interest. And if you note that because there was such a strong influence of the pharmaceutical industry, private insurance industry, and the hospital associations, there was no public option, there was no insurance rate regulation or drug pricing regulation. And as a result, if you look, we continue to spend more of our GDP on healthcare and still have lower life expectancy. If you look down below, not only are we getting less for what we pay, but each year the number of people that face catastrophic healthcare spending continues to increase, and we have a much larger population at risk for catastrophic healthcare spending than all of our other industrialized nations that spend far less per patient. It's been very difficult for workers as well. We still have a system where workers are stuck in jobs because of their employer-sponsored healthcare. Maybe some of them work in jobs that they hate, but they have to do it because of their healthcare. And not only is it, we still have this coupling of employer-sponsored healthcare with employment, but workers who do get their coverage through their employers are being asked to contribute more of their paycheck each month towards their employer-sponsored healthcare. And then if they utilize their healthcare, they're being asked to pay more in terms of deductibles and copays. Meanwhile, wages have remained stagnant during this period of time, as has overall inflation. And as you really dig deep into patients who have to cover their monthly expenses of their premiums, you can see that more and more Americans report that it's harder and harder for them to afford their monthly premiums. It's harder and harder for them to pay for their copays or prescription drugs. And it's very hard for them to pay for their deductibles, which is the amount of money that we all have to pay before our insurance kicks in. So it's no wonder if you have high copays and deductibles that 1 out of 3 people will put off seeing a doctor because they can't afford it. And 1 out of 4 people with a serious condition will delay seeking care. So when you hear about politicians saying that they would like to increase coverage, coverage doesn't mean access to care, particularly if you have one of these plans that has a very high $6,800, $7,000 deductible, where you're responsible for all those costs before the insurance ever kicks in. And you can see how this disproportionately affects our communities of color down below, that 1 out of 5 Latinos does not seek care because of cost. Roughly 1 out of 6 African Americans also delay seeking care because of cost. And let's not forget, because there was no pharmaceutical drug pricing control, that over 45 million Americans each year report that they did not fill a prescription because of cost, and 1 out of 5 seniors, even with the donut repair in the Medicare Part D, still report not filling a prescription because drug costs are too high. And while Kaiser, United Healthcare use their market cap to negotiate drug price discounts, Medicare is still prohibited from negotiating drug prices. The other thing that we should point out is that the issue of narrow networks. And what that means is you may participate in a plan that only allows you to see 25% or less of the providers in your given area code. And when you hear people say that a government plan will prevent you from seeing doctors, the private insurance industry currently does that for many of us. And just to show you that this is not only in terms of doctors, but it also precludes you in terms of what labs you can go to, what radiology centers you can go to, and even what hospitals you can go to. So we have this convoluted healthcare system where many of you may be getting your employer coverage through your employer. One year you may have it through United Healthcare, and next year it may be through Aetna. Then the next time it may be through Cigna. But what will happen is each time that you go to the doctor's got to figure out, wait, am I in your network anymore? What's your copay? What's your deductible? And if you lose your job, now all of a sudden you are scrambling to either find coverage on your own under the exchange if you can afford it, or now if your income drops below a certain level, you are eligible for Medicaid, which Medicaid is also grossly underfunded in terms of reimbursements to providers. And especially here in California, a lot of doctors, because the reimbursement so low, refuse to participate in that. And if you have Medicaid, you will have a harder time finding a doctor. Meanwhile, hospitals are trying to figure out, are you Medicare, Medicaid? What is your private insurance? Are we even one of the hospitals that participate in this? And so it's a very convoluted, inefficient process, and makes a lot of the cost that is not even spent on patient care dedicated to managing all of these complexities of our healthcare system. And it's no coincidence that between 1990 and 2015, and even up to now, you see this explosion of healthcare administrators. Meanwhile, the number of doctors that have been trained during this period of time has remained relatively flat. And it's also no coincidence down below, if you compare the curves of how costs have ballooned, it sort of mimics the number of administrators that we've seen in terms of the growth there. And let's not forget that the United States also has a higher overall administrative cost as a percentage of its healthcare spending compared to all of the other industrialized nations. And this is especially true for hospitals that spend roughly $1 out of every $4 of their budget on administrative costs. In fact, Duke University Medical Center has 957 beds, and yet it still has 1,600 billing clerks. So as a result, the United States does spend more on administrative costs than we do on long-term care. And if you look at how much we spend per capita, it's not even close. It's almost like our military defense budget, where we spend more than the next 30 countries below us. This is very similar in terms of administrative costs. So as a result, we have been named as the least efficient healthcare system by the Commonwealth Fund. And the Bloomberg World Rankings, as far as efficiency, doesn't even list the United States healthcare system in its top 15. And if anything, the whole coronavirus situation has really exposed all of the brokenness of our healthcare system. All of the lies that have been perpetuated about our healthcare system have really been finally refuted. And let's kind of dig into this a little bit. So one of the things you heard during the Democratic primary debate was President-elect Joe Biden saying how Italy's death rate was an indictment of how a government-run healthcare system was compared to the United States. But look what's happened since that statement during the Democratic primary. Our death rate has continued to explode, whereas countries such as South Korea, Italy, and other countries that have a government-run healthcare system have kept their death rates relatively low. So that's, again, one lie that was said during the Democratic primary that has now been debunked. You also had Amy Klobuchar say that a government-run Medicare for All plan would kick millions of people off their employer-sponsored health care. But look at all the people that have lost their employer-sponsored health care during this time of COVID. As of October, it's estimated that roughly 7.7 million people lost their employer-sponsored insurance, and then an additional 6.9 million were dependents of these people. so that the total number of people that were affected by job loss in terms of their employer-sponsored health care was at least 14 million people. But if you also look at the occupations with the largest number of uninsured workers, these are a lot of our frontline workers, right? Our cooks, our cashiers, our waiters and waitresses. So not only did you have a big chunk of people lose their health care because of their employer-sponsored health care, you had many of our frontline workers who were uninsured, and these people were more likely to be infected, live in multi-generational houses, and as a result, delay seeking care as well. So all of these things inevitably, I think, contributed to what we saw, which was a disproportionate amount of death in communities of color. But let's look at the loss of healthcare in other countries during this time of COVID, right? So again, another myth that was debunked, that employer-sponsored healthcare was much more secure. But this has again exposed the fallacy of employer-sponsored healthcare, particularly in a time of a pandemic or an economic downturn where people will be laid off. So I think many of us believe that healthcare is a human right and not a job perk. And if anything, COVID-19 has definitely highlighted the need to really make this a reality. But let's not forget who has actually done well during this pandemic. It's been the health insurers that have had record quarters in profits. So at a time when the pandemic has affected everyone, it's no wonder that 76% of all voters now support a Medicare for All plan, including 88% of Democrats, 63% of independents, and even a majority of Republicans. As Donald Trump nears the end of his term, let's not forget the things that he and his administration have done to undermine the Affordable Care Act, whether it be imposing work requirements on Medicaid recipients, whether it be stopping the reimbursement to insurers for low-income deductible and copay waivers, removing the individual mandate. And as a result, even before the COVID, you could see that the number of uninsured was creeping up each year. And while the Supreme Court is currently weighing in on whether or not to repeal the Affordable Care Act, we need to really understand that if they did allow for repeal, that roughly 135 million Americans could be denied coverage because they have a pre-existing condition. There would be a ban on lifetime coverage caps eliminated, and all of the essential health benefits would no longer be required. And the Affordable Care Act repeal would have a detrimental effect disproportionately in communities of color. You can see that the number of people that would lose coverage, particularly among the Latino and African American communities, would be quite large. So here are the existing problems right now as you start to look at whether or not a public option or Medicare for All would solve these. Is we have somewhere between 31 to 35 million people that are uninsured right now. We have no coverage for our undocumented brothers and sisters, no insurance rate regulation, no drug pricing controls. We still have very narrow networks. We have very high copays and deductibles. We have this tremendous administrative waste that leads to an overall inefficient system. And we have a lack of health security with job loss. So as I mentioned, a public option has also garnered a lot of support among Republicans and Democrats. And President Biden, who has been a staunch opponent, President-elect Biden, who has been a staunch opponent of Medicare for All, has suggested that he would like to introduce a public option. He would like to expand Obamacare tax credits by eliminating the sort of income cap. Right now, it's for over 400% or less of the poverty line. And he would also like to allow uninsured and non-Medicaid expansion states to buy into a public option. So all those red states that refuse to expand Medicaid, they would automatically be enrolled in a public option. And here are the sort of the key features of public option plan. It would be a government administered public option, although I've heard there have been discussions about letting it become like a Medicare Advantage plan where some private insurance industry would administer it. They would still maintain sort of the complexity of our existing system, Medicare, Medicaid, employer and marketplace insurance. They would enhance premium and cost sharing subsidies. Regarding who would be eligible, those are the details that still need to be worked out. So let's look a little bit at Medicare, right? This is 1965. I was born 2.5 weeks before Medicare was signed into law. And despite the fact that Medicare tends to take care of our older, sicker members of our country, most of the people in Medicare have 3 or more chronic conditions. Some have cognitive impairment. They tend to be older, and some of them tend to be more disabled. But in spite of taking care of more of the what we call higher risk population, Medicare has done a much better job at controlling costs compared to the private insurance industry. And so instead of having this massive convoluted system, we would argue that having a simplified single payer system would really make a lot of sense. So let's really look at a comparison of this. But before we do, let's not forget that some Democrats as well as the Republicans have said a Medicare for all bill is too expensive. Right after Bernie Sanders announced his plan, the Mercatus Institute did a study that said it would cost $32 trillion. Ironically, when Fox and Friends did a poll about this and said, would the benefits outweigh the costs, overwhelmingly, people participated in the poll and said, yes, that it would more than justify it. But what was dishonest about not only the Republicans using this fear about cost was a lot of corporate Dems did as well, is that the Mercatus study, which was funded by the Koch brothers, is a center at George Mason University. It's a very conservative think tank. They found that while the Sanders plan would cost $32 trillion, it would actually be $2 trillion cheaper than if we did nothing at all while insuring everyone. But nobody seemed to mention that when they slammed the cost of this plan. So people need to realize that with or without a Medicare for all plan, we'll probably end up spending over $34 trillion over the same period of time. But meanwhile, you already have people that are undermining the public option, saying that it could add $700 billion to the federal deficit in the first 10 years. So let's look at the difference between a Medicare system and a public option. First of all, a Medicare system would cover everyone, including our undocumented brothers and sisters, where a public option would not. Medicare would not be tied to employment, whereas a public option does not eliminate employer-sponsored health care or the vulnerability of losing coverage once you lose your job. A Medicare for all plan would eliminate copays and deductibles, whereas a public option still has copays and deductibles for some of the people. Medicare does not dictate which doctors you can see, whereas a public option does have narrow options. Just if you look at our Affordable Care Act exchanges, they have very, very narrow networks. Medicare will reduce federal spending while insuring everyone, where a public option will only add additional cost to our federal budget. Medicare eliminates administrative waste and costs, whereas the public option just adds one other layer of complexity to our fragmented, inefficient system. And Medicare would also negotiate deep discounts in drug prices and costs of services, where a public option would not make the system more efficient or reduce costs of premiums, drugs, or services. Now, a couple years ago, I got myself into trouble because I said that the reason we cannot have Medicare for all is because we have too many corporate Dems who are beholden to the private insurance industry and the pharmaceutical industry. And I used a very insensitive term for which I apologized. But let me explain or show you what I meant. So with regard to our legislators, this was just from last year that showed that of the 130 House Democrats who did not support Medicare for all, They received over $43 million from the pharmaceutical industry and the private insurance industry. And most recently, just during the Democratic National Convention, the Partnership of America's Healthcare Future, which is basically a group that was created by the health insurance industry, pharmaceutical industry, and hospital lobbying groups that was created to oppose Medicare for all, has now decided to oppose the public option. What should be noted is this is made up of former Democratic and Senate aides, including one of Secretary Clinton's top aides. And not only have they decided to oppose the public option, but now it's been reported in the Hill that Democrats likely won't bother with the public option fight next year if Biden wins election, which he did, and just took back the Senate. So when I talk about how corporate influence renders our legislators, basically makes them beholden to the private insurance industry and the pharmaceutical industry, that's exactly what I meant when I used that insensitive term. So just to conclude that my mom came to the United States in 1951 as an immigrant during the Korean War. She was a refugee. She was able to eventually graduate from Columbia Teachers College, and the first person to hire her was the late, great Shirley Chisholm, who was the first African-American woman to not only be elected to Congress, but to also run for president. And in 1972, she ran under the mantra of being unbought and unbossed, unlike too many of our legislators today that I just showed you. But she said, "We have never seen health as a right. It has been conceived as a privilege available only to those who can afford it. And this is the real reason the American healthcare system is in such a scandalous state." And I would sadly point out that this is probably more true today than it was back in 1972. So having said that, I appreciate you taking time to learn more about why a public option is not robust enough. I hope you will all continue to roll up your sleeves and fight for Medicare for all. Really do appreciate the time, and thank you very much.